Hello, you're tuned into the Spectrum, and this is a podcast and information channel to let you know a little bit more about Autism Spectrum Disorder. I'm here with Dr. Jay Gibb, the owner of Autism Parent Care. My name is Harold H.B. Bell, and we'll be hosting this great program each and every week. We're going to bring you some new information. One of the first things that we need to know, Dr. Gibb, I guess, so that people can understand what we're doing is, what is autism? That's the question, the big elephant in the room.
Autism is a developmental disorder and it affects the brain. So the result is behaviors that are different from neurotypical children. So to qualify for the diagnosis of autism, you have to satisfy at least three criteria, which is deficits in language, nonverbal, not able to speak, or able to have a few words but not able to use the language effectively, or able to make sentences but having problem using it in a two-way communication.
So I might be able to hear you well, but I can't communicate back on what I just heard.
That's right.
Right, and that's a major problem that I know that we face out here at Autism Parent Care. So how many children would you say are born with autism? I know this number keeps going, shrinking and shrinking as far as one out of. How many children are born with autism?
Well, the 2019 census, which is done by the CDC, shows 1 out of 59.
And is that globally?
It is globally, and there's relatively small differences between ethnicity and countries.
So this is it doesn't have the effect like a lot of different diseases and illnesses as far as I guess different ethnic groups. This is anybody can be affected by autism.
Anybody in any country, yes.
Now in the U.S., I was reading some numbers there. In the U.S., I think that we have how many children born with autism? It's a little bit less, I think, or more children born with autism in the U.S., I was reading.
Well, that I am not so sure. I have not looked at the differences globally.
Okay, well, we want to find that out to let people know, because we want to make sure that because we don't have a cure, we don't know really anything other than genetics play a big part in it, in autism. But after that, we're kind of still figuring it all out, would you say?
Yes, we are.
Now, and I just mentioned there's no cure for autism. So what can parents do when they find out that their child might be on the spectrum? What should we do first?
We may not have a cure, but we do have effective treatment. So the gold standard treatment that is approved by the Surgeon General is ABA therapy, which is applied behavior analysis therapy. So it's a behavior therapy. There are other methods as well, and of course there are pharmaceutical, there are medications, there are other therapies, and flow time. There are certain educational approaches that help people on the spectrum learn and hopefully be able to manage their environment.
What would you say, if we could just say the biggest myths or biggest misunderstanding about autism, what would you say they are?
Well, that I would say that they will grow out of it without intervention. They will not grow out of it. They will get worse and worse. That's the biggest myth.
So
yes.
Creating a way that they can live as socially functional as possible is what we're trying to achieve, but they're not going to ever get over this.
That's right.
Good. Now, if a family was to figure out early something's just a little bit wrong with my child, because we have so many different things going on in the school system, a lot of families, and I know this is probably where ethnicity and low-income families come into play. They're not aware of some of the symptoms or some of the things to look for, and they get their child in school, and they're not really addressing autism. They're addressing behavior problems, more likely ADHD or ADD. Talk about that so we can get parents to understand autism and what to look for, even if they think it's ADD or ADHD.
I will have a more expanded video just on its own right, discussing the symptoms and diagnosis, because it's quite in-depth. And autism, yes, is different from ADHD. However, the autism does have features of ADHD. Autism is primarily a social disorder, so inability to connect, lack of interest in pleasing other people, and the other part that they may have that an ADHD child does not have would be sensory sensitivity. They are sensitive to noise, tactile, light, and crowds, and things like that. And also there are stereotypical behaviors. So they would insist on maybe flapping their hands, they would walk on their toes, these are sensory issues. Or for the higher functioning ones, they would appear as very stubborn, not able to change their mind easily, and not liking to change what they do, transition difficulty. Transitioning from one activity to the other can be a big struggle. So these are some of the features. But of course, it's more in depth than that.
Yeah.
So generally, if you see that you are struggling with your child, no matter what you do, they're not coming along with you, right? Your explanation, your giving them consequences, rewarding them, no matter what you do. If you are still hitting a wall, these are some of the signs. These are red flags.
And that's the reason we're doing the spectrum, and we call it the spectrum because, as Dr. Yip alluded to, not one case is like the other. Every individual case is going to be different, but some of the symptoms and the signs remain the same. So now you know what autism is. We're going to share with you in our upcoming segments what we know.